Welcome to the Purple Cloud podcast. And today we're joined by David White to talk about all things Huangdi Neijing. Welcome, David.
Thank you so much, Daniel. Thank you for having me.
Yeah, it's my pleasure. I'm looking forward to talking about this. Now, David's got I'll do the sales pitch up front. Dale's got a course coming up on the Huangdi Neijing, and he's someone who's really sort of delved in deep for, I guess, over 20 years into this book and really extracted a lot of, I wouldn't say, well, maybe not lost techniques, but because they're still written down, but things that are no longer really taught in acupuncture schools and this kind of thing. Um, Before we get into all of the Neijing, maybe David could let us know how he started his journey into Chinese medicine.
Yeah, certainly. Uh, I grew up with a very supportive and inquisitive family, and when I was young, my love for martial arts was supported by them, and I started training. Well, at that time, I was training Taekwondo, and I was training it pretty intensely and competing in it for a while, and then. One day, my brother said he was walking through Mossman here in Sydney and said, "There's this guy who does kung fu," and he probably mispronounced it Qui Gong and he went Qigong, and it was a gentleman called John Dolick, who I think you've also met in the past.
Yes, yes.
A rather unique individual, and I started learning different aspects of just normal, Chinese kung fu, and as I got deeper into it, we started talking about Chinese philosophy, aspects of Taoism. I started reading the Tao Te Ching and Zhuangzi and things like that. And then I wanted to learn more. I actually injured my knee in a tournament, and he was my acupuncturist. And I just fell in love with the idea of it. And that led me to go, once I finished school, straight to university, or to college at the time, Sydney Institute of Chinese Medicine, and do my degree there. And then I found my way to China and then back to practice. And that's kind of been the story in short. And part of that was also going into I suppose, the internal martial arts as well, mainly Bakwazang. And martial arts has always been sort of the journey with it, which has been really nice. I always thought I was going to be a martial artist with Chinese medicine on the side, and I ended up being Chinese medicine with martial arts on the side. But that's the way it goes.
Well,
And
maybe
then
we could dip into that a little bit because
yeah,
I also have a martial arts background, but I had so many injuries that I was never really able to compete and stuff
yeah.
like that. I don't know if do you follow MMA? I think you must.
I do. I'm a black belt in Brazilian Jiu Jitsu as well,
Yes.
and I've trained with and trained a few people like for MMA and UFC, and I had 4 amateur MMA fights in my time.
Oh wow.
Oh yeah, yeah. So and it was terrible, but yeah, I had them.
Well, yeah. Well, it's pretty destructive on the body.
Yeah.
Um, you saw what happened to TJ Dillashaw with his shoulder, how it came out in one of his
Yes.
fights.
Yes.
So
That's
that's kind of what was happening to me for a long time. So
right. Yeah.
so my journey, the reason I bring it up is because my journey with martial arts has been entwined with the healing. And
Mm.
I'm curious if you could, yeah, in what ways these two things have affected each other and how the martial arts has sort of affected your approach in clinic.
Yeah. It's interesting for my sort of besides that knee injury for my Taekwondo Kung Fu. I did some early kickboxing and boxing as well back in the day. And when I did the amateur MMA, besides that knee injury, I have been injury free up until um, until I was blue belt in jiu-jitsu, and I had a head clash.
Ooh.
And then that brought about some pretty searing pain. And I found I had quite severe degenerative changes in my neck that I never knew about, canal stenosis and things like that. So it completely changed the way I approach training in terms of contact and like no more wrestling and things like that. But jujitsu was fine, like grappling was okay. No more sparring to head clashes and things. And so it wasn't around then. That was probably 10 years ago or so now. That's when I really started thinking a lot about, because of my own rehab, acupuncture particularly can help with rehabilitation from traumatic injuries from martial arts. And I started actually I treated a lot of people from my gym. It's always shoulder, hip, or neck. It was kind of those things. And it actually drew me back into, because I kind of got out of it, drew me back into the Chinese martial arts. And of course, the warm-ups from Chinese martial arts, the slow practices of things like Tai Chi Chuan or aspects of Bakwa Zhang, like the circle walking, the way that the joints move and all those sorts of things, it brought me back into that as preventative medicine for it. And that's been my savior, for it's actually allowed me to go back into jiu-jitsu with more vigor. I'm not competing at all, and I won't again, but with more vigor, and just because the joints move differently now and the muscles are different. And that sort of combined approach, I think, was really a godsend.
Yeah, I think we can say a lot of things about Chinese martial arts and the state they're in, etc. these days. But
Yeah.
to me though, it's what's quite unique is how developed that side of it is, the body mechanics, and also just the ability to sort of recover from injuries and stuff. They do have these systems built into
Oh,
it.
it's amazing. And I mean, yeah, I was going to say, yes, the state of martial arts does mean that there's a lot of, I mean, it's the same with Chinese medicine. There's a lot of sort of diluted BS out there and commercial things and so forth. But there's still a lot of really good, solid teachers and practitioners out there, exploring this sort of stuff. I think you're one of them, looking at, injury prevention and those things. And so I think it's important to harness it and not give up on it, and make sure we educate the public about it too.
Yeah, for sure, for sure.
Yeah.
And getting back to your early your TCM journey, your Chinese medicine journey, what was your first encounter with the Neijing? I imagine it would have been like in first, second year of studies or something like this.
Well, it was because of John earlier, actually.
Oh, great.
Yeah, so I was probably like 15, 16, and the encounter was that sort of, it was just discussing the idea of it. It was looking at, I mean, we're talking sort of base theory of the Su Wen, that sort of thing that he would have been more familiar with. And then I think I'm pretty sure my mum bought me, when I first started, The Way of Heaven by Claude Larre.
Oh, yeah,
I
yeah,
think,
yeah.
yeah, first two chapters sort of explain, as because I was talking about it with her and those things, and so I started just falling in love with the book from there. And then just I kept coming across, I had Elsa Wies's, one, and then I started looking at some of the Chinese ones, thinking that I could read Chinese at all back then, which I couldn't. And
Oh, it's good to have in the library though.
yeah, that's right. And then I think really early versions of some of the Vietnamese versions of the Ling Shu, which I don't put much
I
weight in
remember
now.
that one.
Yeah,
I've got it.
and Henry Liu's really early ones that I have. I've got his, and I just started just exploring it more and more. But it wasn't until after I graduated, and I'd spent some time. I was doing my internship in Anhui, and working with some practitioners there, and exposure to different needling techniques really sort of opened my eyes there. Working with particularly a gentleman called Dr. Tai. But it wasn't until I came back to Sydney I started working with Dr. Tai. So it's Tai and Tai, two different people. And he's very, at the time for me, very unique needling methods. And they were all, as I came to realize, we started doing theoretical study with him, it was rooted in the Ling Shu and his approach and everything like that. And that really opened my eyes to the importance of that text.
And were these needling methods described in the Neijing, or things he'd
Yeah.
extrapolated from the theories?
No, so I mean, even though Dr. Tai, was my sort of initial Neijing teacher in that way, he was not just pure Neijing in the way that I am now in my practice. Like I don't divert from the text at all. He but they were the techniques that came from Ling Shu chapter 7, which is the Guanzhen. And I worked extensively with him through that chapter and through those techniques and through the pathology related to it which has been the focus of my teaching now for a long time, sort of reverse engineering the pathology of Ling Shu Chapter 7, the needling techniques, because it's such a unique chapter in regards to the structure of the actual chapter itself, the language of it, the position within the current extant version of the Ling Shu. It's just a really unique chapter. So that's been a big focus of mine from that. But that was where I worked with Dr. Tai for some time with those methods.
And what surprised you about these methods, or what sort of
Well, I
attracted you
think,
to them? Or
yeah, I think coming from generalized TCM. Now, I was also exposed to two wonderful practitioners here in Sydney who you might know as well. So Hoku Hen,
Hmm.
who you would have come across, and Daniel Deng.
Oh, I did some interning with Daniel as well.
Yeah, so Daniel and I were very close for many years. I mean, the whole reason I started lecturing was when he left SITCM, he said I should take his place, and I'd only just turned 21, so I was he put a lot of weight on my shoulders for that, and I really thank him for it. But between those two, I would say Hock was very much towards the TCM style of needling and selection. Daniel has a very inquisitive mind, I think, and likes to experiment. And so even with him working through aspects of unique needling was there, but I spent time in his clinic, probably a couple of years, but then sort of fell out of that when I went to China. Then you start seeing other ones. The Neijing needling techniques, I think what really sort of drew me to them, and what I found unique with Dr. Tai's methods and interpretation of those, was the distinct focus on levels in needling, and needling various tissues, and also the means of diagnostics to use those different techniques. I think that was really a big aspect of every single aspect of the movement of from needle choice to technique to patient experience to outcome was so precise in every way. And I think that really drew me to explore those more.
What sort of diagnostic techniques? I'm curious. Is it most palpation based, or?
So Dr. is heavily observation and palpation based. Um, and then for myself, I am as well, but the palpation for determining exactly which area to needle would be determined by where the disease is sort of initially manifesting, at least from conversation or things. So pulse diagnosis became a big part of that. And within the Neijing, or within my style, as I sort of teach it, I work on the pulses of the wrist, but also Renning Chenkol, which is the neck and wrist, is a huge part of my practice, and Sambu Joho, which is the 9 indicators, 3 levels sort of pulses around the body as well. So I use those sort of 3 pulse methods to come to as my core sort of diagnostic criteria to come to my treatment prescription, I suppose. Yeah.
And I'm just wondering how this, you had these sort of mentors early on in your training, and how did your own sort of understanding of the Neijing develop over time after this?
Yeah.
I remember a Facebook post from a long time ago.
Uh-oh.
You went off into the bush with a copy of the Neijing or something for a week by yourself or something
That's
like
right.
this. It's stuck
You,
in my memory.
I was in Tasmania.
Oh, okay, cool. It makes sense. It's a good
Yeah,
place to
I
read the
was
Neijing.
hiking, but
We got four seasons here. It makes a lot of sense to read the Neijing.
yeah, well, it's very quick because you get 4 seasons in a day there, so you
Well,
get
that's also,
a year's work in one day. But yeah, that's right. I what it basically, and my focus, and I suppose that's because of the impact I had from early teachers. My focus, even though it's Neijing, is definitely Ling Shu Jing. The Suen obviously is vital, but I use the Suen as an adjunct to understand aspects of the Ling Shu Jing. And so yeah, so I would sit with the Ling Shu and do exactly things like that. I would hike with it. I did everything with it, and this is even pre Unschul's Ling Shu. I would do things like that.
mm,
So I would have ones that I very coarsely had translated, and ones mixed together like is it the Wu's one, which is Englished by his that Huangdi Neijing, which is a big mixing bag of like, it sounds like it's Google Translate's been used for it. It's pretty terrible. And I have different writings or subsections of it, or notes from clinic and things like that. And I would just sit. It was just sitting with the text for a very long time, and working my way through it. And I was doing a lot of that just solo for such a long time. And then in about 2009, could have been 2008. 2008, I met Arno Versluis, and Arno and I became very close. And he said, if you're interested in Neijing, there's a few practitioners in Portland, Oregon, who are working on it, a few students there, with a guy, which was Ed Neal, and who runs his own seminars. And I thought, no one here, I don't have a community here in regards to discussing these things besides my own students, which is fantastic. And then the relationship with Dr. Tai, which is very student-teacher relationships, but it's nice to talk to someone else who's inquiring to the text. So I reached out to them, or Arno introduced me to some of them, and then I flew to Oregon and stayed with Ed. And we realized that even though it's about the same amount of time that we've been studying this material, and even though we have very different backgrounds, we did have quite a similar approach to sort of the theoretical inquiry of it. And I think that approach maybe isn't so parallel right now. I think Ed has gone into his own, further deeper into his own understanding, as have I, and they're kind of a little bit diverging a little bit. Not that there's anything wrong with that. It's the beauty of the text that it has so many different interpretations. But with that, with some of his students over there, who later became some of my students, we developed what was called the International Society for the Study of Classical Acupuncture, or ISCA. And for about 3 years that we did these scholars retreats in the mountains of, I think it was officially, it's near Hood River, or White Salmons or something, in Washington, at a Buddhist abbey, where we had people come and talk and deliver different aspects of the Neijing. And, we sat around staring at streams and forests and,
Yeah, very nice.
looking at it that way. And it was great. I mean, we had some wonderful people join us. In the last one, we had Zeb Rosenberg, Lorraine Wilcox, and Sabine Wilms, and some other people like that. And we all had a pretty wonderful time. And then I think just the logistics of it and the management of it became a little bit overwhelming for some people, and it disbanded. And that's where I came up with the idea of doing the Institute of Neijing Research. That was around 2012. I started doing that, just to teach some seminars and sort of my ideas.
And you were teaching in college at this time as well, weren't you?
Yeah, so I taught at SITCM for 20 years in total. As soon as COVID hit, I bailed, but I was teaching there. I mean, I feel sorry for my early students there, because they really were learning off a child, but mentally and physically. And it was such a wonderful learning curve, and I really met some wonderful people there. I at least laid the foundation for me to how to teach and how to run a class and those sorts of things. I recently was chatting to students of mine from 18 years ago, which is wild to me that I'm still doing this and loving it as every day, so yeah.
So over this time of being with the Neijing and teaching students, and I'm assuming you taught a lot of the people at SITCM these methods as well.
Yeah, when SITCM went through a pretty radical change. I don't know if you remember, in 2007 or so. It went under.
Some scandals.
There was probably some not so savory people involved.
Yes.
And was bought out. I was at that time teaching mainly foundational acupuncture studies, channel studies, those sorts of things, aspects of diagnostics, aspects of foundational sort of Chinese medical theory as well. When it changed, in about 2007, I took over the techniques class as well. And and this is pre-registration, that sort of thing, they kind of gave me free rein and said, we want you to develop this course how you want to. And so I developed it purely based on the 27 techniques of the Guanzhen. And when I say purely, it was 80% that. And then I made sure there were the ones that obviously tick the boxes for generalized exams as well. So there were those other techniques in there, and the ones which, setting the mountain on fire and cooling the sky and all those sorts of things that people use as well. So they were layered into it, but yeah, they gave me that free rein, and I must say, teaching it, from that, 13 years of teaching that in that setting to people who were brand new to the medicine, gave me a lot of perspective on the use of the techniques, the practice of it. We did tons of prac every week and that sort of thing. And so I really, that was a big part of sort of forming these lectures and forming also my own clinical practice.
Yeah, I'm wondering how the students received it, because even like first, second year students, they'll would have read a little bit of basic theory and this and that.
Yeah.
When I went to China as well, and I had my first Neijing class, I thought I was finally going to learn the real stuff, and it was just my class was just like they'd cherry picked all the stuff
Yeah.
from the Suen that fits the TCM fit theory nicely.
Yeah.
It was very
I was going to say
distinct.
that's what TCM is in the end, isn't it?
Well, yeah,
Cherry picked
well.
medicine. Yeah.
So,
um,
so yeah, the lucky students, and I'm just wondering how they
yeah. I
received it
mean,
and stuff.
I as much as I pushed them to sit down and read the text as much as they could and gave them aspects of translations or my own interpretation, there's only probably a handful who really went deeply into it and probably still apply aspects of that today. The thing is with teaching someone who's in year two, you teach them for a year in year two techniques and all those things. And then year three, they have a different teacher and they start using a guide tube again or something like that. I banned guide tubes in my class very early. So
Oh,
I,
controversial.
I just hate them. But so I think from that perspective, that was that always happens. What happened with SITCM though also was there was a radical change in the actual who the students were, because in about 2005 or so we started delivering the course in bilingual. I think it was 2005, could have been about 2006, bilingual Chinese and English. And then we went trilingual and had Korean, Chinese, English that the course was taught in. And then by the end of it, when registration came in, the bilingual aspect wasn't really allowed for teaching purposes. The classes had to be taught in English, but it did mean that it had attracted a huge number of mainland Chinese and Korean students to that college. So, I mean, mid sort of, teens, like 2015, 2014, the classes were 80% Chinese, 10% Korean, and 10% sort of, Caucasians who had no idea what all the other students were talking about. So they had that language base there. And so we would teach aspects of it still in Chinese, or at least have conversations like that. My conversational Chinese is absolutely horrific. So that they helped me with that, but I've lost it again. But so they had, I think, a huge advantage that they could have access to the text, access to commentaries, access to those things over the non-Chinese English students. And to an extent, some of those students excelled radically because they sat with the text. They really loved my approach to it. And then the others would nitpick exactly like you said. They would just go, oh yeah, the Neijing's good. It's kind of like old theory. And I always talk about it's old theory, but it's not what Chinese medicine is today. And I'm sure some of them
That
still.
debate's been going on for probably a few hundred years
Yeah,
now, but
yeah.
yeah, it's
Yeah.
interesting. I'm curious how your understanding as well over this time must have developed. Is there anything you look at, have you changed your opinion on certain things in the Neijing? Have you
Uh,
developed certain
I think
ideas?
I do all the time. So I run this study group. It's called Lingshu Labs, and there's about 20 of us. We meet once a month, and we go through so I present a thematic analysis of a chapter, and then we go through clinical aspects, or we do like a focus of a particular part of that theme of that chapter. And when I'm doing that, I'm writing it and presenting it like, yes, I am the teacher. And every time I do it, I immediately learn something new every time as well. There'll be a different way that a character is presented, or a concept which I think I've known for many years, that all of a sudden now I'm looking at it through a different lens. That just changes the way that I might approach it. It changes the image that I had of the body in that little way. And that, so I think there's always minute changes constantly happening that are informing me clinically, and then ones in the clinic that are informing me theoretically, so I have that constant sort of cyclical. It's like going through a washing machine. Each cycle, I come out a little bit clearer. Well, actually, no, it's not always true. Sometimes I come out a little bit more confused, but the next two cycles I come out clearer,
Yeah.
and I think that that yeah, I think I mentioned this when I did do geological. I was saying to Michael that I know that my study is set for the rest of my life, because I can adjust. If I just work with that text, I will never ever know it all.
Mm.
So I can just continue to work on it. I'll never be bored. I can always go through it.
Yeah.
It's like learning martial arts, right?
Yeah.
You never know it
Exactly.
all. That
Right.
the idea of becoming a master in this stuff, it's not really. Never really happens. You just see it, from multiple and different angles all the time, and you kind of start again over and over. And
Mm.
yeah.
Is there anything specific that comes to mind, like a big sort of light bulb moment or a big
um.
sort of
Oh well,
shift?
I think uh, years ago, one of the biggest changes was my approach to Jinglo theory within it. Mainly how I structure, um, and this is as in the way that I've, again, from me trying to teach it, has informed myself of the theory. The underlying theory was just the structure of the pathology of Ling Shu chapter 10 and its relationship to Neijing medicine as a principal structured style of acupuncture. So not one. There's not one little thing which sort of went off as a light bulb moment. There's always been things like that. Just how I call it the scaffolding of the text. That scaffolding of the text and how it shifts and changes in certain ways. That was probably one of the biggest ones, and that's what I'm teaching actually in this upcoming course is what I call the compass of the Jinglo, which is looking at that the pathophysiology of Ling Shu chapter 10 in relationship to the text as a whole, and then in relationship to modern practice. So, when they have these lists of symptoms and lists of approach of disease states and things like that, what the Neijing actually, what when you read between the lines in regards to the principle of the text, principle of the medicine, what that actually means in modern day clinical practice.
Mm.
So yeah, so I suppose it's more like miniature paradigm shifts that have been occurring as I've been studying, rather than one little light bulb moment that's changed the way I practice altogether. Yeah,
Right.
yeah,
And I think you're someone also you're talking about scaffolding, and where my mind went with that, which was important for me, was to build the cultural context around
yeah.
the Neijing. I think if you don't have that, it's just like
Uh,
I don't know, it's like reading another language, even if it's been translated. It's
Absolutely, and that's that would be another thing, which is just, well, I suppose for me it was for my study of the text that surrounded the Neijing, or at least informed it, from a non-medical perspective. When you read things like the Tao Te Ching of Zhuangzi, you go good, but then you realize those, I mean, they are foundational, amazing texts. But then you start to come across, like the Huainanzi for me,
Finanza especially.
you can just delve so deeply into it.
Mm.
Um, Guanzi as well, and all of a sudden now you go, oh, I had a lifetime of work with the Neijing, and now I need a few more lives for each of those texts as you go through it. But going through different aspects of some of the Confucian texts as well, which I would always kind of go, oh yeah, not so interested in when I was younger, um, and just playing with it, looking at how they approach ideas. I gave a small talk on Hun and Po recently, and then looking at how this concept of morality and how that existed pre-Neijing is now something that I'm really fascinated and want to go deeper
Mm.
for myself. And that's also for my own self-realization and cultivation as well.
Mm.
It's so important to do that. So yeah, the culture that surrounds any of these medical texts. I mean, I talk Neijing, but if you talk about the Nanjing or the Shanghan Lun, or even if you go later into later dynasties and eras, there's just so much of it in there. It's endless, and it's amazing.
Yeah, and you mentioned your self-cultivation practices, and I believe this was a big part of that culture surrounding the Neijing
Mm.
at the time. What are some of these practice? I mean, you've got the the medicine, but do you do
Yeah,
some
I,
other
I
things?
mean, I my inquiry into, let's say, Taoism, um, is limited to that sort of Han pre-Han era. So I can't remember what book I was reading. I think they called it classical Taoism, and then there was sort of
Oh, there's some people won't even
organized Taoism, right?
yeah, some people won't call it Taoism. They'll call it, like
That's
Tao
exactly
or
right.
something. So that
So
everyone has different
uh,
classifications
we
for
can
this
call
stuff.
it pre-Han and Han Chinese thought.
Yeah, works for
And
me.
but that for me, and I mean, I sit and I will read the Zhuangzi on a daily basis, and just for my own contemplations on life. But from a more, um, uh, I'd say, organized inquiry into self in that early tradition, the Huainanzi has been the biggest influence on me. And I've got so much more to learn about it. There's just I'm an absolute novice when it comes to that text, but it's a monster text, and the Lu Xue Chunqiu as well. Uh,
Yes, they're both monsters.
the most huge texts, and there's so much you go down cultural rabbit holes with all these things, and so that's been a big part. But quite interesting for my own sort of studies as well. I personally, like from a meditation practice and things, I step way outside of that era. And, Chan Buddhism and the Nyingma tradition in Tibetan Buddhism is something which has always been a huge impact on me too, and something I'm exploring more as time goes
Fantastic,
on. Yeah.
fantastic.
Um, but, I'm also of the way I've been trained in martial, like for Bakwat Zhang when I was learning with John, I think I spent the first 3 years walking in a circle before I learned any technique,
Mm,
so I'm also of the mind when it comes to meditation training, just sit and do nothing else, or
mm.
if I do Zanzong, stand and do nothing else. You know what I mean? So I think keeping it simple often is the greatest thing to cultivating self in the modern day. When
Yeah,
there's so much, guided meditations, all these things which I don't particularly enjoy.
yeah. I think that's been my experience as well. Is there's like this profundity in the simpler
Yeah.
sorts of practices and exercises, but
And I think that can link heavily into the medicine too.
mm,
One thing for me in my clinical practice is that sort of foundational approach to self-cultivation is when the disease is complex and more chronic, the more simple message that you give the body, the greater the outcome in the end.
rather
So
than trying to fix everything all at once and
yeah. So you just say to the body, look, I just want you to shift this way. And that one little shift, all of a sudden, it's like dominoes, the rest start to fall. It's like, I always say, it's like the butterfly effect. It's just that one little nudge, and all of a sudden there's quite a profound change,
mm,
further down the track. And so I think that's finding that simplicity in the midst of all that of complexity is really important, as much as it is finding tranquility within the midst of chaos.
mm.
Yeah.
Um, so I'm curious as well. What's if there's maybe one or two things you could pick out, but I guess I'm looking at like how it's taught to most people, the Neijing in their education, but things people misunderstand about the text.
I think that,
Communicate to them what you.
yeah, I think the greatest misunderstanding, or the greatest problem with elements of Neijing education is that it's often not approached as a system of medicine. It's approached as a text. I mean, it is a mixture of different texts by different authors, without a doubt. And it's been edited greatly, and probably parts have been lost and parts have been added, and those things. But that underlying, I mean, I harp on about principle. The underlying principle of approach of that text is, in my opinion, a very complete medical system. And I think that's very evident in the Ling Shu. I think it's less evident in the Suen because of the amount of additions to the Suen by like Wang Bing and so forth, although those additions were within the principle of approach of the Neijing. I think that's the biggest issue. And so I think from that, it's not approached with the amount of respect it deserves as a system of medicine. When I think, and I think that's just simply because during history it just changed. During the course of the impact of the text, the Nanjing particularly made a huge impact throughout other areas of Asia, particularly Japan, Korea, although the Neijing obviously made a big impact in Korea as well. Just as a sort of systemized approach to clinical acupuncture. And then, some aspects of diagnostics as well fell out of favor. Renying Chen-Ko was a pulse method that just kind of disappeared. By the time you're reading the Meijing, even though it mentions the Renying, I mean, in certain translations that I've seen, it says Renying just means the young aspect of the pulse at the wrist. So it's no longer Renying at the neck, which is, to me, doesn't make any sense. And I don't know much about the Meijing. Someone else can probably comment on that. But just that sort of aspects of it just fell out of favor. The use of the 9 needles would have changed dramatically as technology changed as well.
Maybe you could explore on that, because that's one of the very interesting things you teach, and you've got a whole array of these needles and stuff.
I got a whole surgical tool set.
Yeah.
I look, I mean, it was funny. I probably posted a video of a selection I have, and someone said that's a whole lot more than 9. But it was about 27 needles. But the 9 needles, for me, and teaching Neijing technique, it's level-based needling. So you have to have the right tool for the right level, which means the right pathological presentation in order to employ the right technique. So the thickness of the needle, the depth of the needle, and those sorts of things are vital. Obviously, nowadays, the filiform needle, which in the Neijing was called the Haozen, that needle is the most commonly used, and it's the most commonly used for a reason. Nowadays we use long filiform needles, short filiform needles, sometimes thicker, sometimes thinner. So from that perspective, it actually takes up a broad category of what would have been interchangeable within the 9 needles you can do with kind of one style of needle today, and that's just through ease of production and those sorts of things. But even though I'm presenting the 9 needles and everyone does think it's quite unique, it's still aspects of those tools are present all throughout clinical practice, from like the Fengzhen, which is like the bleeding needle. We don't use like a Pizhen, the sword-shaped needle, much today, because cutting in acupuncture is not really. And if you needed a boil lanced or something, you're probably going to go to your GP,
Yes.
Today, and that's fair enough. That's not a problem. Let them do it anyway. But it was just about understanding this concept of right time, right tool, right technique, and correct outcome. The aspects of those 9 needles are used in Japanese acupuncture. The Dizen, I think, is the Teishin in Japanese acupuncture, or at least the similarities are there. And I think that's where in Chinese acupuncture, not just classical Chinese acupuncture, in Chinese acupuncture, the use of blunt needles has kind of disappeared.
Yes.
To an extent,
Yes.
And so I use anywhere from sort of 3 to 5 different types of blunt needles in my clinical practice. And that might be where, I don't want to damage any other tissue structures. I want to put pressure on visible low vessels without puncturing and letting blood, massaging the divisions of the flesh, the technique like called funsa, where you can actually massage between muscular divisions. So I think it's just important to have a good tool set when we're doing it. Yeah.
Oh, that's awesome. Do you know of many other people doing that?
No, not really.
No.
I don't know of many practitioners. I mean, there are out there ones who are using a few different ones. I mean, I'd say there's tons of practitioners out there who bleed people. So from that perspective,
Yes.
they're using, bleeding needles and different massage tools. But I don't know of many people clinically sort of employing the Jods and the 9 needles in that principle of the Neijing in the way that I am. But I'm sure they're out there, and if they are, I hope that they yell out to me as well, because I'd love to talk to more people about their interpretation approach, which is one thing that the Neijing, talks a lot about aspects of technique. I mean, Renying Chen-Ko is a great example of the Neijing talking about a method, talking about the importance of it, but not mentioning how to do it.
Mm.
It doesn't talk about what fingers to use. It's not technical in that way. And even with some of the techniques, it talks about them, but it doesn't. It just hints to, well, it's two needles for here, it's two does that, with the idea. And this is where I think the Guanzhen particularly is, which is Lingshu chapter 7, is a particularly unique chapter in that I'm sure it comes from an older text or a different sort of text that it was kind of inserted into the Lingshu, or maybe the original Zhenjing needle classic was a big part of that. It doesn't go into the nuances of how we're meant to hold the needle and do those sorts of things. There's a lot of assumed knowledge there with it. And
So how did you reverse engineer all this stuff? Just trial and error in
a
clinic?
huge amount of trial and error, and also the understanding of, because it doesn't go into the nuances of those techniques in the way that you'd hope, going through understanding what those techniques are treating. So, for instance, if it's treating something like a certain type of B presentation or cold presentation, or it's talking about a particular level, understanding what that means in the context of the Neijing. That's what I mean by reverse engineering. We're working through everything around that chapter to get an understanding of how to diagnose it, how to palpate it, what does it present like in clinic, and then applying that technique as best we see fit, and going from there. A good example, Zuizi, like quenching needling, fire needling, is something which is practiced in many different ways now. Is probably one of the more common sort of classical techniques of the Neijing around, as a unique one anyway, but it's used in so many different ways. And so when I use fire needling, I'm using it in a very particular manner for, cold trapped within the jingjin, within the tendon presentation. Yeah.
And have you come across any of these? Because in the Shanghan Lun, there are all these fire needling gone wrong kind of
Yeah.
passages. Have you ever come across anything like this?
So I was taught at a very, very early age in my acupuncture career not to do anything more than 5 insertions with fire needling, simply because of what could go wrong. And I do pretty much stick to that rule. I have come across and heard some absolutely horror stories of practitioners who will remain nameless of nearly killing patients with fire needles.
What?
70 odd insertions, things like that.
Oh my
People
Lord.
passing out afterwards. Yeah, but they can talk about it.
Brutal.
Yeah, which is just scary.
Yeah.
But yeah, so that's right. The Shanghan Lun, talks about when the acupuncturist stuffs up. I can't remember the formula though. Is it Bai Hu Jia Ren Chen Tong or something like that? I can't remember. I'll have to look
I've
it up again. I
forgotten.
should probably have that on deck so I can give it to people.
Yeah.
But yeah,
Um, I was just going to ask as well, because I think it's something possibly the American or Northern Hemisphere practitioners, um, I just don't think it's in the forefront of their mind. But living in the Southern Hemisphere, there are certain things that often don't transpose when we get into the more cosmological
yeah,
elements of the
like
Neijing.
the Wu and Luqi
Wu Yun
aspect.
Liu Qi and
Mhm.
even the Jiugong Bafeng and the
Mhm.
This is why we don't have a Tai Yi here, but I'm just wondering how you have tried, because I've been trying to bridge this, and it's a rough
Yeah.
job.
Um, so that so Wu and Luqi and the nine palaces, things like that, are definitely my own weakness. That's what's lacking in my studies.
Mm,
It's something a Dr. Tai could not care at all about.
mm,
He didn't have time to. He would see up to 80 people in a day. I mean, he didn't have time to consider, you know, all of heavenly glory as he was needling.
mm.
But it is something which consistently fascinates me, and I want to learn more about, and I want to learn how to apply it more. Um, Tyler Rowe, who was a student of mine, he is, as I joke, he is my time lord, and he's the one that, I mean, and particularly, there's a lot of wonderful people who are inquiring into this concept, but as you said, they're mainly Northern Hemisphere people.
Mm,
Tyler, as a Southern Hemisphere practitioner, certainly is more conscious of that, does a lot of conversions of that, and some of it which is really good. I mean, he does. He's also a student of Arnaud, Versluis, and he does a wonderful little chart of sort of the Wu and Luchi patterning and things for that study group, every seasonal sort of change, and it's fascinating. Yeah, it really does fascinate me quite a bit. There's aspects of it I employ, which is just in regards to maybe aspects of stem branches, components, but it's not a big part of the way I was taught or the way I practice. So it comes down to, again, learning off someone who was incredibly raw and mechanical in their approach to needling and approach to disease. I used to semi joke that, all that Wu and Luchi stuff is all in the Dalun chapters of the Suwen, which means it was added later by Huangdi, and therefore it's not officially Neijing. But I only did that to cover up my own lack of understanding in it and weakness in it. It's something I'd really want to delve more into. We're going to have on through the INR, we're going to have. I mean, Tyler has done work for me in the past, and will continue hopefully to do more. And I think in the future, Deborah Wolf from the UK, she's a student of mine. Yeah, so she's been studying with me a little bit, but when I say studying with me, she's got many years of experience, and she's going to do a few lectures on different aspects of inquiry into that as well, and maybe even linking to the Huainanzi too, which would be really interesting.
And that's in this course coming up?
No, that'll be separate. That'll be separate.
Okay.
No, this course, unfortunately for the students, is all me, so they have to deal with that. But future courses or short courses and things like that will be added from those two individuals, and a few others that I'm sort of working with, who in the future will come on board with their expertise, which will be great.
Great. And talking about this course coming up, did you want to go into a little bit more detail as to what's going to be covered?
Yeah. So it's called the Clinical Neijing Program, and the goal of it was to primarily work through sort of our foundational material for the course is the first 13 chapters of the Ling Shu. But we're going to be using that as like I said, the foundation, but then we branch off in regards to understanding, say, particular disease states or needling techniques or, course theory or diagnostic methods and those sorts of things. The idea of the course was, from my perspective, there was a really huge part of Neijing material. And the whole reason I started the Institute of Neijing Research was to develop clinical material, because I've just found that no one was teaching clinical Neijing material. There's a lot of theoretical material out there as individual things. There were people developing courses for sort of theoretical things, but they didn't have the clinical background. And as a clinician, and more so than a scholar, I thought I just need to bring that clinical work to the forefront of Chinese Neijing education. So the course is kind of a mixture of the last sort of 16 years of how I've been teaching this material, of giving people a very clear-cut, step-by-step sort of guide to Neijing acupuncture, or particularly Ling Shu acupuncture as a system. So we'll go through, like I said, scaffolding the text, understanding the principle and structure of the text. Very early on, we jump into sort of the 4 key diagnostic matrices, which is the pulse systems, complexion diagnosis, palpation methods, needling techniques, and then working through that Ling Shu chapter 10, pathophysiology of the Jingmai, well, not just chapter 10, sorry, 10 through 13 of the Jingmai, of the Jingjin, just brief discussion on Jingbie and the Lo and Lo Bie as well. And bringing that together, but not just to regurgitate the text, that's not my goal, because anyone can just go and read the text with ease now, but to show the structure of the text as a practice, as a system, and how they can immediately implement that into their clinical practice. My goal is hopefully to have the majority of these students, some of them have been studying with me for many years, who are coming on board, others are going to be brand new. My goal is to turn them into just Neijing practitioners, but I know that they'll defy their teacher and just mix it with their other practices anyway, which is fine. But so I'm trying to make sure that I design the course, well, the majority of the course is already designed to be something that they can take on board, sit with for as long as they want, sit with the text and experiment with these methods themselves with some guidance.
Yeah. And I guess it'll open up the text in a a new way once they have this sort of clinical
Yeah,
light. They'll be
yeah.
able to open the book, read it, understand what's going on.
And that's why a huge portion of how I'm teaching, and this is going back to what you mentioned about like sort of light bulb moment, or like I was saying, like a paradigm shift, is a huge portion of how I'm teaching the Neijing now is not through regurgitation of quotes or from the text or anything like that. I mean, that's part of it, is to say, make sure you go and read this chapter to get an understanding of what I'm talking about, in this particular area. But looking at sort of patterns within the text and structures within the text of how to give the student an approach in the clearest way that they can pick up that book at any time and just read between the lines and see, oh, this is what it means here, and this is how I'm going to use this clinically, or this relates to this portion of the text, and just creates this nice sort of gentle pattern within it as well. Yeah, like I said, pattern of approach, and I think that's where a lot of people just don't like them. Well, don't appreciate the Neijing, or at least are afraid to spend time with it, is because it's not written in a very clear manner, or it's at least it's not structured in a clear manner. I had an interview earlier this week, and I said it's not like the Shanghanlong is so beautifully structured, particularly in the current state that it's in. It's so perfectly structured that we have, Taiyang disease and Yangming disease, Xiaoyang, so forth. But the Neijing's not like that, and it means that you've got to try to find that structure within the mess that it's presented currently in. Yeah.
How do you deal with the fact that there are so many different, like it feels like schools of thought coming in to, and mishmash, and there's like it can be contradictory at times, the text,
Yeah,
or
I
apparently appears to be contradictory.
yeah. Look, there's just so much out there in Chinese medicine now. I am doing my best to try to block everything else out and just
Mm.
focus on what I do. I mean, even within Neijing acupuncture, there's now courses popping up left, right, and center on it, and some are excellent, and then some, I I'm not sure where they're getting their material from, unless they're just regurgitating someone else's ideas, without having also a clinical practice to back it up. I'm always concerned with that, in that, we've had this big sort of classical renaissance in the last 20 years in the Western world in Chinese medicine, as these books have become translated. The popularity of the Shanghan, popularity of the Neijing and the Nanjing and those things as well. And then all of a sudden, and people like to jump on the sort of the bandwagon of, oh, I've got access to this, so now I am teacher of it, without actually taking the time to sit with it and do things. It'd be the same with, again, martial arts, learning off someone online and all of a sudden becoming a teacher of it after a couple of months. That's not going to work. The only thing with martial arts is that you can go and test those people pretty easily, when in
Well,
the
the
Chinese
test is
medical
in
world, it's a little bit harder.
the test is with the patients, right?
Mm,
Clinic.
it is, but it's easy to fabricate your results for a student who wants to learn off you.
Oh, I'm sure.
Yeah. So there's so much coming out there. I think there's a lot of really good material, though. I think, like, for instance, Purple Cloud Press, like, you are publishing a ton of commentaries and translations, and that sort of material is going to be absolutely invaluable to um, the futures of Chinese medicine, because
You remember
already,
when we started out, right? There was nothing, really,
yeah,
really
yeah.
nothing,
So,
not
so, that,
much.
so that's a couple of years, and already the library of sort of traditional Chinese medicine in the West has already expanded tremendously, just from that, just from you guys alone.
Well, there's other people.
And
I can't keep up with the books now. It's too many.
yeah. I mean, that's what I'm saying. There are other people, but I think that, like, the focus on commentaries that are being translated, I think is so excellent, because it'll continue to build that sort of, I would say, genuine Chinese medical lens that we all desire to have, and that so many do not, and in Chinese medicine, well, globally, not just out in the West, globally.
I don't know if it's a secret, but I mean, you have a book in the works as well, or probably have done for
Yeah,
a
it
number of
was it
years.
was a secret, but
Oh,
yeah.
sorry.
No,
I
I'm
can.
joking. I'm joking. Yeah, no, yeah. So there is a book in the works, yes, and
Yeah.
hopefully soon. Actually, I
Yeah.
release some aspects on that too.
Yeah.
Uh,
Great.
I just need my son to grow up a bit faster. He's only 17 months, so
Ah, right.
he's a hurdle with that one.
Oh, well,
He's
this,
Chinese. His Chinese is terrible, but yeah. But yeah,
um,
it's yeah, no, that is something I want to work on and have published soon.
yeah, it'll be, I think, very valuable work because, again, there's not a huge amount that it's one of those things that
No,
not a huge amount comes out about. There's a
no,
lot of Shanghan Lun material, but not
no.
as
I
much
mean,
Neijing
you're going to
material.
have Corey, his Huangdi work, and that's
Ah,
another.
that's right. Yes.
Yeah, I mean, that's going to be fantastic as another perspective of Neijing research. Um, you had aspects of Zhang Jingyue's works as well
Mm,
already. I think, I mean, the Lei Jing's going to be, obviously someone needs to translate that in its
it's
entirety.
huge.
It's massive, or at least in sections.
Yeah.
Um, and yeah, so I mean, yeah, look at the Shanghai Lung. So much work on the Shanghai Lung, and yet there's still so much more to come out. It's
Mm,
endless, and it always will be. And
yeah,
that's the
it's
beauty of
true.
Chinese medicine. But we've got to make sure, I think, we just try to preserve the integrity of a lot of these practices as much as we can, and with good, solid clinical foundations. I think that's
Mm.
important.
And so what are the dates or any information on the course if anyone is
So
interested, wants to check it out?
yeah, the best way to check it out would be on my website, which is instituteofneijingresearch.com. I'm doing it in collaboration with the International College of Oriental Medicine in the UK. So they invited me. I have a wonderful sort of number of students in the UK. They invited me to sort of collaborate with them, and so they would host it and also host the practical sessions as well. So from the online portions that will initially be once a month, about 4 hours once a month of just lecture work. Will start February 25th, I believe, and which is a Sunday, and then there will be a forum and Q&A and case study analysis within that, as in separate to that, but online as well. And then the practical seminars and workshops will happen at the end of each part. So the whole course is 20 months, but it's 3 parts. And so at the end of each part, they'll be held in London, where we'll work through the practical applications of the techniques, pulse palpation, clinical work, that sort of thing.
Oh, great. Are you going to do clinical stuff in Australia as well, or?
I'm hoping to, because it's the UK sort of course, I didn't promote it much in Australia, but there's
Mm,
been quite a few Australians who are now coming on to study.
mm,
So what I've said to them is that I will just sort of honor it, and I'll just make up the time here. And whether we do it, because it's not going to be, I mean, we're getting actually quite large numbers for the whole course. It's not going to be large numbers in Australia, but if it's a good solid group, I'll definitely do the pracs here. What I'd like to do for Australia, and if the interest is there, is to really do a proper needling workshop here,
mm.
separate to this course as well, just so there's a group of people that did learn that off me a long time ago in Australia, but now, new practitioners, more interested parties. So
Oh, for
a good
sure.
solid needling, sort of 3-day workshop is what I'd like to put into the works eventually for Australia, and also for North America as well, where I've for a long time the majority of my students were there, in the USA and Canada, but and a number will be joining this as well. But same thing, just to develop that.
Mm.
So yeah, it will
Oh,
it will
that's
certainly
amazing.
occur.
Well, yeah, hopefully that gets word out and we
Yeah,
get a bit of
I
a group
appreciate it.
together.
Yeah, and I hope there's many more podcasts coming, because I really enjoyed your last one with Chris and Greta.
Oh
So
yeah, yeah.
yeah,
Well, this is I had to like we moved to Tassie and it was difficult to do last year, but
yeah,
yeah,
it's great. I think these formats are so good. It's always so interesting hearing from different people in the profession, and yeah, and
yeah,
particularly Australian practitioners. I'm not saying just to hear me, but you had James and Tyler in the past, and
yeah.
so it's just so great to see what the state of Australian Chinese medicine is, because we're so small, but yet we've make quite an impact globally. Uh,
Yes, it's very
yeah,
unique.
yeah,
Very
absolutely.
unique.
Yeah,
Awesome. All right, David, we might leave it there.
wonderful.
Thank you for coming on and yeah,
Thank you for having me.
and really I really hope your course goes well and this
Thank
gets
you.
word out and Yeah.
Yeah. And if not, I've
People
got
study the
a lot of
Neijing.
time to go. So I'm still a baby.
Yeah. Well, yes.
Yeah. Yeah. Wonderful.
Great.
Thank you so much,
Well,
Daniel.
thank you.
Yes.
If you enjoyed this video, please like and subscribe.